Welcome to the PTCB Prep Guide, the place where we take tricky pharmacy topics and make them super simple. Today, we're tackling a big one, USP 800. This is absolutely critical stuff you're going to see on your PTCB exam.
So let me ask you a quick question. What if I told you that most students get questions about this wrong on the exam, but after today, you won't? Stick around because we're going to get you the exact answer.
All right, let's get into it. We're going to break down all the must-know rules for handling hazardous drugs, or HDs. This isn't just about passing a test. This is about keeping you, your coworkers, and your patients safe every single day.
So here's our game plan for today. We'll start with the key terms, then we'll move into the special environment you need to work in. After that, we'll talk about your safety, the gear, and the procedures. Then we'll cover handling and disposal, and wrap it all up with a real exam-style question so you can see how this all comes together. First things first, let's get crystal clear on what we're actually talking about. What exactly makes a drug hazardous? Well, to put it simply, a hazardous drug is any drug that can harm you just by touching your skin or by you breathing it in. We're talking about things like chemotherapy agents, but the list is actually much longer than you might think. And the key here is that special handling isn't optional. It's an absolute must. And here is a huge tip for the exam. The risk of exposure, it's not just when you're mixing the drug. No, it's everywhere. From the second that shipment shows up at the receiving dock to the moment that empty vial gets thrown away. The PTCB loves to test if you understand this whole life cycle of risk. All right, so now we know what HDs are. Let's talk about where you handle them. And I'll tell you, this is not your typical pharmacy clean room. We are stepping into a very, very controlled space. Let's clear up two acronyms that trip people up all the time, C-PEC and C-SEC. Just think of it like this. The C-PEC is your primary control. That's the actual hood or the bubble you work inside. The C-SEC is the secondary control. That's the entire room that the hood sits in. It's like a safety bubble inside another safety bubble. Okay, let's talk numbers. This is one you gotta burn into your brain. All sterile hazardous drug compounding has to happen inside a C-PEC that maintains ISO Class 5 environment, or even better. That is the gold standard for keeping things sterile. And here's the second number you have to remember, 12. The C-SEC, that buffer room, has to have at least 12 air changes per hour. This basically means it's constantly sucking the contaminated air out of the room and shooting it outside, which keeps the rest of the pharmacy totally safe. Now let's talk about a really cool piece of safety equipment. The CSTD. You see, when you stick a needle into a drug vial, the pressure can cause a tiny, invisible spray of hazardous drug to shoot out. A CSTD creates this sealed system that stops that from ever happening, protecting you from breathing in anything dangerous. So we've covered the room and the equipment. Now let's focus on the single most important part of the safety plan. You. This is all about the personal protective equipment, the PPE, you have to wear and the procedures you must follow. I want you to think of your PPE as a suit of armor, because that's what it is. And you need every single piece. We're talking 2 pairs of special chemotherapy gloves, a gown that closes in the back that nothing can soak through, full head, hair, and shoe covers, a face shield with goggles, and an N95 respirator. You can't cut corners here. This is a huge technician alert. Your safety's on the line. Here's another number for your flashcards, and it's a big one. Your outer chemo gloves. They have to be changed every 30 minutes, or right away if they get a tear, a puncture, or you know for sure you touched a drug. This is non-negotiable and a super high-yield point for the exam. Now, cleaning up is not as simple as just scrubbing a wipe. USP 800 has a very strict 4-step process, and the order is everything. First, you deactivate the drug to make it harmless. Second, you decontaminate to get rid of any residue. Third, you clean to remove any other gunk. And finally, you disinfect to kill any germs. Just remember that sequence, D, D, C, D. Okay, so you're all suited up, the room is safe. Now, let's walk through the day-to-day stuff, how you actually manage these drugs from the moment they arrive to the moment they get tossed out. Hey, remember that question I asked you at the beginning? Here's your answer. If a damaged shipment comes in but the vial or bag inside is still sealed, do not open it. Just label it as hazardous and send it right back. But if it's actually broken and leaking, you have to carefully take it inside your C-PEC to contain that spill before you bag it up. 2 totally different situations, 2 totally different procedures. Okay, this is a massive red flag for the exam and for safety in real life. Look,
Your standard sharps and biohazard wastes, that goes in the red bins. But all hazardous drug waste, from your used gloves and gown to the empty drug vials, it must go into a bright yellow waste container. Mixing these up is a really big deal.
All right, let's put all this great knowledge to the test. This is where we see how these rules and ideas actually show up as questions on the PTCB exam.
Okay, so here's the scene. You're compounding methotrexate, a pretty common chemotherapy drug. You're about to draw it up from the vial. What specific piece of equipment does USP 800 require you to use to keep you safe from that potential spray? And the answer is the Closed System Drug Transfer Device, or CSTD. Yep, that's the device specifically designed to equalize that pressure and to contain any dangerous aerosols, making it the required tool for the job. Whew, we have covered a ton of ground. So let's wrap this all up by quickly going over the absolute most important points that you need to have locked down for your exam. Let's do a super fast recap. Your environment, an ISO class 5 C-PEC inside a negative pressure C-sec with at least 12 air changes per hour. Your PPE, 2 pairs of chemo gloves, changed every 30 minutes. Your cleaning process, always follow that DDCD sequence. And your key safety gadget, use a CSTD for vial transfers. If you can master these, you're going to be in great shape. But look, if you only remember one thing from today, let it be this. USP 800 is all about protecting everyone. Your safety, the safety of your coworkers, and the safety of the patient. It all depends on following these rules, no exceptions. Remember to keep it simple, keep it safe, and always follow the protocol. If you found this helpful, do me a favor and hit that like button, share, and subscribe for more. Your support really helps us bring this kind of clear, easy to understand content to students just like you. I'll see you in the next one.